Hey, good morning and welcome to UroNurse News. I'm Vic Senese. Today, a major new scientific review delivers reassuring news for millions of people taking cholesterol-lowering drugs known as statins. Now, according to a large analysis published in The Lancet, statins are far safer than previously thought. And researchers say it's time to update the warning leaflets inside medication packages because their fear may be keeping people away from life-saving treatment. Now, statins are widely prescribed to lower LDL, the so-called bad cholesterol. They are proven to reduce the risk of heart attacks and strokes. Cardiovascular disease remains one of the leading causes of death worldwide, responsible for roughly 10 million deaths each year and about a quarter of all deaths in the United Kingdom. So it's not a small issue. Now, concerns about side effects have circulated for years. Patients often report symptoms such as memory loss, depression, sleep disturbance, weight gain, and even impotence. But this new review, funded by the British Heart Foundation and conducted by researchers from Oxford University, say most of these concerns are not supported by high-quality evidence. Did you hear that? The findings come from randomized trials involving more than 120,000 people. Participants were given either a statin or a placebo, a dummy pill, and importantly, no one knew which one they were taking. Now that's critical, because when researchers compared side effects between the statin group and the placebo group, the reports were almost identical, which strongly suggests statins were not the cause of most of those reported symptoms. About 66 possible side effects listed in the medication leaflets. Only 4 showed any association with statin use. And even those occurred in very small percentages of patients. Those 4 were liver test changes, minor liver abnormalities, urine changes, and tissue swelling such as swollen ankles. Importantly, there were no increase in serious liver disease like hepatitis or liver failure. So while blood tests may occasionally show mild changes, they did not translate into major harm. Now let's be clear. Like any medication, statins are not completely without risk. Statins can, in rare cases, cause muscle damage. They can also slightly increase blood sugar levels, which might bring on diabetes earlier in people already probably at risk. But again, these complications are uncommon. Lead author Professor Christina Reith addressed this issue directly. She noted that ongoing confusion and concern about side effects have discouraged many people from starting or continuing statin therapy. She said, and here's her quote, "Ongoing confusion and concern about side effects mean many people are not willing to start them or stop them. This is a major issue." She added that while people may experience symptoms while taking statins, we now have really good evidence that statins are not the cause of common problems. And she emphasized that for most patients, the benefits far outweigh the risks. Senior author Professor Sir Rory Collins echoed that message. He stated that now we know statins do not cause the majority of the side effects listed in the package leaflets. Those information sheets need to be revised to help patients and clinicians make better informed decisions. Professor Brian Williams of the British Heart Foundation added that negative publicity around unproven side effects has likely caused many people to miss out on therapy that might have saved their life. He described the findings as providing very powerful reassurance. And that reassurance matters because stopping a statin without medical guidance can increase the risk of heart attack and stroke. So what should patients do? Experts stress that statins save lives. But if you're experiencing symptoms or have concerns, discuss that with your healthcare provider. Don't stop the medication abruptly without medical advice. Now, Professor Brian Williams of the British Heart Foundation added that negative publicity around unproven side effects has likely caused many people to miss out on therapy that could save their life. He described the findings as providing very powerful reassurance. And that reassurance matters because stopping a statin without medical guidance can increase your risk of heart attack and stroke. So what should patients do? Experts stress that statins save lives. But if you're experiencing symptoms or have concerns, talk to your healthcare provider. Don't stop your medication abruptly without medical advice. Hey, this Saturday on UroPatient, is your foreskin tight, painful, or impossible to retract? If you or someone you care about is dealing with a foreskin that they can't pull back, you may be experiencing a condition called phimosis, a common but often misunderstood condition affecting boys, teens, and adult men. On this week's UroPatient, I'm going to break it all down, what phimosis actually is, when it's normal versus a problem, the difference between physiologic and pathologic phimosis, symptoms you should never ignore, when to see a urology provider, and treatment options from things like topical steroids to circumcision. What happens if phimosis is left untreated? Many men delay care because they feel embarrassed, but understanding the condition is the first step towards relief and better health. So whether you're a parent, patient, or simply want accurate urologic education without the myths, this episode delivers clear, compassionate answers. So be sure to tune in this Saturday for UroPatient at uropatient.com to take control of your health with facts you can trust. Tomorrow on UroNurse. Folks, sometimes you just find a subject that's too good to pass up. Ever wonder how many times you really fart each day? Smart Underwear has the surprising answer, and it's way more than you might think. Join me as I dive into the science, the laughs, and what your digestive system is trying to tell you.
UroNurse News, every Monday through Friday at 9 a.m.